Hi, this is Alan Beck, and this is for the final video project for Principles of Practice in Business Management, Summer 2016. Um, yeah, it's just the final video project. So, first off, I'm going to present my two folders. I have our first one being the Practice Management folder. I only have the stuff that we were given in on Blackboard currently in it, but I plan to add more to it. And then secondly, research binder, research binder with our separate tabs. And then I have a couple of studies. I don't have a ton of studies. Um, I have the Atlas vertebra realignment and achievement of arterial pressure goal in a hypertensive patients study. I have a study on the myelopathy and the cervical lordosis with vertebral subluxation and hyperlordosis. I have a study on the developmental delay syndromes, specifically psychometric testing of before and after chiropractic treatments of children. Another on the receiving end, it's called On the Receiving End. It's patient perceptions with side effects of cancer chemotherapy drugs. I have another study on the side effects of non-steroidal anti-inflammatory drugs on small and large intestines in humans. Another on the cardiovascular side effects of newer antidepressants and antipsychotics, and whether these new drugs have the same concerns as previous ones. And that's actually all of the research that I have done currently. So we're going to be moving into the second and larger portion. Hold on a second. Second and larger portion of our video, and that is our mock. What's the word I'm looking for? Our mock patient report of findings and otherwise like our mock visit basically. So we're basically gonna go through our report of findings as if they've already come in and we've done all of our testing, our examinations, our range of motion testing, X-rays, that kind of stuff, and we're gonna talk a little bit about our mock patients' discovery, like what we found with them, as well as what we recommend, and yeah, it's a report of findings. Like there's no other a really good way to put it. Uh, yeah, so let's get started. So our patient, who I'm just going to be calling Frank from now on, he came in with low back pain, specifically on his left side, like his left low back. Uh, we found in palpation that sorry, oops. His case history is that he works he works on a construction job. Like he's constantly lifting things, climbing up and down ladders. Because he's doing small construction, small businesses, houses, that kind of thing. Nothing like large scale, like big machinery. Well, huge machinery that is. Uh, in the physical examination, specifically with palpation, we found edema uh, on his left side, um, below his PSIS, and to the right. Well, not to the right. In more medial. We had found that he had a high right shoulder, as well as a head tilt to the left, and that his hips themselves were uneven, with the left being a little bit higher. For his range of motion, we found that his uh, turning to the right was limited, but the left was fine. And then for lateral flexion, we found that he again couldn't flex as far to the right as he could to the left. Um, for his range of motion along his along his what's left of it, what's left of his spine, he was able to turn to the left really easily, but he had a lot of trouble, and his range of motion was restricted turning to the right. And lateral flexing, he had the same issue. He was able to go to the left pretty easily and with minimal discomfort, but when he was going to the right, it was causing him a lot of discomfort. Within his case history, he had worked a small construction job, and he was specifically coming in because he was coming down a ladder, and he was coming down the ladder. He missed the last rung with his foot and went down basically 2 rungs, and basically did a flat drop from about 3 feet up onto both feet, but it was enough that it shot pain from his left foot, which is the foot that hit first, all the way up all the way up his spine, and he has been in severe pain ever since, not being able to walk very far. Uh, Neurologically, he's in pretty much constant pain across especially his low back, but going up into his thoracic and cervical spine. Uh, Moving on to that, with palpation in other areas, we found that in his cervical spine, along levels of along the C5 level, he had some issues with edema and some tenderness along there, and with a particular his leg check, his left leg was shorter. Uh, the X-rays that we decided to take were our practice standard X-rays, as well as actually no extra ones, but we specifically took uh, X-rays of his hips and his low back area, and then we took one of his cervical spine, and then and that was it there, because we didn't find any problems within his thoracic spine. Within his lumbar spine, we found that his hips were indeed unlevel, with his uh, left hip being up higher, and we determined that it was probably an ASEX. We determined that it was an ASEX between the palpation findings and the X-ray findings. So moving into moving into his cervical spine X-rays, we did indeed find that he had an open wedge to the left between C5 and C6, and that was probably what was causing him his discomfort there. When we decided that he was eligible for care within our practice, he we we recommended that he come to our healthcare class so that he could see what our values were, as well as get an idea of where we stand before he decided that he wanted to commit to us as his chiropractic care provider. Within that class, we talked about where we stand, in that Uh, our job as chiropractors is to fix the damage that has been done, and then it is our goal is to maintain the wellness that maintain the state that we brought you back into before your injury, and in hopes that the furthering chiropractic care makes you the best human being that you could possibly be. Um, we he agreed to care, and then we moved on into uh, what we actually recommended for his care, and we were going to specifically adjust pelvis and cervical area. And at first, uh, we wanted to do 3 times a week for we said uh, we said 2 weeks at first just to see how he would handle everything. Um, and from that point, we decided that if still wasn't improving at the end of those 2 weeks, we would give another 2 weeks of 3 times a week, and if not, we'd move him down to 2 times a week for an additional 2 weeks. Uh, and at the end of that first month, we would take another set of X-rays to see his progress and if he was recovering. Um, if he wasn't recovering, I told him that there was probably something else uh, that we probably wouldn't be the right place. Well, we probably wouldn't be the right practice for him, and I would refer him out. Otherwise, we'd move to a once a week or as needed um, practice, in that he would just come in for basically corrective care and then wellness care after a long enough time. Uh, the problems that he had himself were severe in that they were causing him pain, but they weren't actually, well, causing him a great deal of pain, but they weren't super severe in themselves. And it would probably be easily fixed within a month, and after that, we just wanted to maintain him and make sure that he was doing well, and the pain and tenderness wasn't returning with our upkeep visits after that point. Um, we think he'd be doing fine by the end of that first month, and then after that he could start actual wellness care, and that he'd be on the right track. We then discussed payment methods, as well as um, we discussed payment methods, um, and then specifically with his case is that we provided him with pamphlets and information that he could give to other members at work, um, as well as family members to get the word out about our practice. And he seemed very excited at the end of his month to talk about us, since we made him feel a lot better. And this is tough because I don't really know a whole lot else to talk about for this video. Um, yeah, so Frank is probably going to do fine within this practice, and we will see at month's end how he's doing. All right, so that concludes the end. Uh, that concludes this video for this project. Um, and I don't think there's anything that I missed. Check through. I showed the binders. And Yeah, that's everything. All right. Thank you so much. Goodbye.